Welcome back to the Modern Metabolic Health Podcast. Today, I have a wonderful guest, Zach Niemiec. He is Vice President of Patient Advocacy for ProCare Health, which is a supplement company that focuses on supporting patients who live with obesity. They've focused on patients who have gone through metabolic and bariatric surgery and are also now helping support patients who are on GLP-1 medication treatment. And so he is here to share his story and some about his work. So thank you, Zach, for being here today.
Thank you for having me, Dr. Ogle. It's great to be here. I'm always happy to share. I'm a big subscriber to the thought that one thing you might say might, eventually roll down the hill like a snowball and turn into like the big thing that helps someone else on their journey. So if I help one other person, then it was worth sharing.
Yeah, well, I'm sure that you will. And I would love to just give you the opportunity to share a little bit about your story with my audience.
Yeah, well, I mean, like many other people living with obesity, my story doesn't start just like when I started the medication or when I had bariatric and metabolic surgery. It starts a long time ago, but to fast forward, I was a child living with obesity. It started to creep in my uh, 10 to 12-year-old range and kind of rapidly ramped up from there. And I remember a lot of diet culture interventions in my youth, including ending up at Weight Watchers at one point. And then I had my first uh, metabolic surgery at 16. I had the lap band, and I was successful with it for a while. And it did have to come out in my early 20s though, because it had slipped and it was deemed that it was safer for it to come out and convert me to one of the other procedures at that time. Fortunately, I had a lot of scar tissue, so I couldn't be converted at the time when it came out. So uh, I had to go a whole other year now without a tool. And of course, without the tool, what happens with the disease? Weight reoccurrence happens. So my I gained the weight back that I had kept off with the band, and I was then later converted to a sleeve about a year later, um, in which I did fantastic with the sleeve uh, for a while as well. And then unfortunately, I mine was done with a hiatal hernia repair, and my sleeve actually kind of came undone, and my stomach went back to virtually its normal size. And the same story kind of continues with weight reoccurrence happening. Now, I considered getting a gastric bypass. There was a lot going on during the COVID years, and that's when I was exploring that. And I had to get a reflux procedure done, which is ultimately what I opted to go with during that time. And that really helped, but it didn't do a lot with for the weight side of things, unfortunately. And then um, in like 2021, I started getting really unexplained digestive health symptoms. And I actually ended up going to four different gastroenterologists, and no one could figure out exactly what was explaining it until I got to the last one. And he goes, I don't think I'm the doctor for you. I think you need to go see a liver doctor. But I'm going to test my theory. And, he prescribed a medication that was for something else, but it would confirm to him that the problem was actually with my liver. And lo and behold, my symptoms of like almost 3 years at that point seemed to have resolved, but it was really just a band aid. Um, and he got me with a liver doctor, and that's when I found out that I had kind of like a mid-stage non-alcoholic fatty liver disease, with steatohepatitis, I believe is the
Mhm.
proper phrasing there. But the doctor then, was, like, well, unbeknownst to me, I had started a GLP-1 while waiting to go and see the liver doctor because there was a wait. And the doctor said to me, well, you've actually started treating your disease without kind of intentionally knowing it, because the treatment for you right now is diet and exercise. And I hate that terminology, but that's that's what it was, communicated to me as. And um she at the time said to me, well, you can continue with the GLPs, or I would advise you to go and get a gastric bypass and, have the weight loss um, help you resolve your liver condition. I was in the process of moving, so I got a new liver doctor when I moved, and we continued on my GLP-1 therapy, and basically agreed together that, well, I'm still losing, so let's follow this intervention till it's, peak, and then see what we have to do from there. And we'll, if we have to use another tool in the toolbox, then we will. Um, so I thankfully didn't have that problem. I kind of hit a peak on semaglutide. So then working with my care team, we switched over to tirzepatide, and the rest of my weight that I was, kind of deemed that was like the range left to lose, I lost. And my liver enzymes and everything are now regularly normal. And this past May, I was declared in remission, but under monitoring. So just to make sure that, if my enzymes do go back up, it's not because the liver is actually sick. It could have just because my liver was under stress for one reason or the other. And so I'm glad to have the constant monitoring. I'm glad to have that available to me. But I kind of hit maintenance last May, and I did not know what to do with that. And it's not no fault of, I think, a lot of practitioners either. For weight management, these are still very new, and I think we're all figuring out maintenance right now a bit. It seems like every day there's a new news article or new abstract study coming out about maintenance. And at Obesity Week last year, there was one about patients moving their dose instead of weekly to every other week, but keeping the same dose. So there's a lot of stuff out there, and I think we're all trying to figure out what is proper. And you know what? I honestly don't know if there's one singular proper protocol. I think that's what we're all going to figure out at the end of this. Is there might be something that works good for this group of patients who have similar type of obesity here, and then this group that has a different type of obesity over here, and so on and so forth. There might be different guidelines and protocols to try and help manage it, because it is an ongoing relapsing condition. And uh, I'm trying to navigate that myself. And people say to me, "Oh, it sounds like you have maintenance figured out," and I'm like, "No, I don't." I still struggle with like some of the things that other people do, of not eating enough sometimes, unfortunately. And like as I have increased my physical activity and been working on my body composition, nutrition, not that it wasn't important before, it's become even more critical because I'm burning more with heavy resistance training, and I'm trying to add lean tissue and, reduce body fat percentage to a reasonable level, and um, just kind of overall work on my total system health. And that changes almost regularly. There's, every 6 to 12 weeks, I'm revamping my workout routine based on body composition scans to see where I'm putting too much on and where I'm lacking behind. Like, I'm a very now like a multiple data point guy. It's not just my blood work. It's not just the tile on the floor, as some people on social media have been referring to it as. Um, I've gotten to this point where it's life beyond actually the number on the scale. And I actually think it's a lot more complicated, because I think when we are in that losing phase, we get very tunnel focused on just that number on the scale. And it is a dopamine hit for us when we see the scale go down. And that's our goal. But a lot of people aren't thinking about all of the other stuff that goes with it. And I don't blame them. It's a lot to put on your metaphorical plate. Thinking about, do I have the right macros? Am I doing the right kind of movement? Like, that can be overwhelming, especially when you're already trying to lose, and that's stressful enough. Anyone who's tried before knows how stressful um, a journey like this is. So.
Yeah.
That's kind of it in a nutshell for you.
Yeah, and I appreciate you taking the time to go over all of that because it is a journey and it's not linear. And I think that really highlights a couple of things. One, that obesity is a chronic medical condition and it's multifactorial, and there are different treatment options. And we often have to combine different treatment options with lifestyle and medication and surgery. And that'll look different from person to person and what that combination will be or what the order will be. But many people do need that combination of treatment to treat their underlying disease. It also highlights that, or it goes against what some people still think is, using a tool or a treatment like GLP-1 medications or surgery as cheating or the easy way out, when that's definitely not the case. You've clearly, before you started those treatments, were trying lots of different things that were not effective. And now you use those effective treatments and have made a lot of progress in your journey. And then you also mentioned how obesity can lead to other metabolic conditions like fatty liver disease. And that was what was identified that then got you started on a GLP-1 medication. And with then treating obesity, that also treated that obesity related condition with the fatty liver disease. So that's a really great overlook and highlight of what obesity actually is and what long-term treatment looks like in real life.
Yeah. And I am someone who has subscribed to the thought that like this is very much a treatment for life.
Mhm.
Um I I do struggle a bit with when I have conversations with some people, and if I reveal I'm on a GLP-1, some of them like who have not known me in my larger size in the past are like, "Well, you don't need them." And
Mhm.
I'm like, well, actually, I've lost X with it. I've changed my body composition. I'm well managed. Like my disease is currently well managed. If I stop it, my disease will likely reoccur.
Mhm.
And like I've been shifting a lot of my conversations away from just the weight loss aspect of this, and talking with a lot of people in daily life who aren't part of my usual circles about changing language softly, and not like scolding them on it, but I go, well, it is actually a recognized disease, and go through it, and then talk about all the different things that go with it. And oftentimes I like to ask someone, well, do you know someone who, has struggled with their weight their entire life? And the answer is usually yes. And I go, well, what did you think their like quality of life was? Did they have any other conditions like diabetes, sleep apnea? And then the answers start stacking up, and it does help move people. I do kind of feel like when I'm in this smaller body and people have not known me ever in the larger body, that it is like coming out a bit. It's like, hi, yes, I suffer with the disease, chronic condition of obesity. I'm Zach. But I honestly, as much as it frustrates me at times, I don't mind it, because um, if it means that, especially for the youth, another generation that doesn't have to struggle in the same ways that I had to with childhood obesity into my earlier years. And uh, you know what? I know this is a lifelong struggle. I might need to reach for another treatment option down the road in order to continue to maintain it. But I'm just excited for those to come after me as well. But right now, I very much see my role is, one, to continue to obviously keep my condition as controlled as possible, but to try to advocate for better access to care, better cost, um, better education, and reducing the stigma as much as I can while I'm fortunate enough to have a platform in this space.
Yeah, absolutely. And sharing your story is so powerful. So I appreciate that you do that. And it can be challenging and it can be vulnerable and scary, especially in rooms or with people that you are not familiar with. But it makes an impact. So I'm glad that you are able to do that. And I absolutely can imagine how, with disease like obesity that is outward facing for the most part, and people can typically, you can look at somebody and then I guess we can make assumptions about it. But when somebody, like you said, when their disease is controlled and their body looks different, then you might not know that somebody has had all of those challenges and struggles before and have gone through everything that someone like yourself has gone through to be in maintenance now. And like you said, that is a fluctuating state with that maintenance phase. But it can be, that is quite challenging to navigate in the world today.
Yeah, and I just a quick shout out to mental health. Mental health is a huge part of the total package of someone's weight loss journey. Um, if you're listening to this, don't discount it. Find someone you can talk to about it, whether it is, a psychiatrist, a therapist, trusted friend, that type of thing. I've been fortunate enough to come across, clinicians like Dr. Robin Pashby, who are doing work with the Obesity Action Coalition. And one thing that she said constantly sticks in my head, and I have to, it's actually very helpful for me on my own journey. Um, is that the brain takes longer to heal than the adipose tissue. So we might have gotten ourselves back into this smaller body that blends in more, but often we still feel like the large person. And give yourself that time and grace, and don't be afraid to work through those things with someone, because again, talking about stress factors and things like that, mental health is very much one of the pillars in my belief in having a successful journey. So um I just like to remind people of that piece too. It's not, again, it's not just about that number on the floor.
100%. And it literally is one of the pillars of obesity medicine for um, the Obesity Medicine Association, medical treatments, nutrition, physical activity, and behavior change and mental health. So it truly is a pillar, and it's something I definitely touch on with my patients. And there's a couple of organizations I refer them to for specifically for mental health in this space, because like you said, with body image and body dysmorphia, anxiety, depression, like gone through a lot of bias in life and internalized stigma and shame, that's a lot to process and to get through. And so having a professional help you with that is so powerful. And when you were speaking earlier, I was thinking about you mentioned many people along the way that have helped you in your maintenance phase or along your journey. What are some of those people that you leaned on for, like, your care team, that you could say, whether they're medical professionals or just people in your life who have helped get you to this place and to maintain moving forward?
Oh yeah. So I've got a big care team. Maybe it's to my insurance company's, pleasure that I have so many. But the biggest thing, one I can say, is don't be afraid to add or subtract to your care team. You need to have the people around you that you're comfortable having conversations with to manage your health, and not hide things like you. Like if you feel like the doctor has a stigma against you, go find the doctor that you can vibe with. Like, there's no harm in that. It might be complicated to switch your medical records over and all of that, but it's worth it. It's very worth it. Um, so My primary care doctor was a huge part of my journey in terms of monitoring labs on a frequent basis. I'm in the large percentage of Americans that don't have insurance coverage for GLP-1s, so I had to seek alternative routes outside of getting coverage from insurance. And I wanted to make sure that, well, yes, I was utilizing a telehealth service, which is under the supervision of a doctor. I wanted my doctor looped in on that care. Because if she had written the prescription for me, she would have been looped in that care. And she did. We tried to get it approved, and there was just no coverage, unfortunately. And so it's unfortunate, but she was there every step of the way. I was getting my labs done every like 3 to 6 months, depending on if something was off, if I started feeling any, sort of way, energy levels, she wanted to make sure that everything was staying in order. And so that was a big part of it for me. The other big parts of it for me were my dietitian, and getting nutrition advice at the different stages for me as well. Um, my macros have changed so much. Because my activity level has changed so much. So you might be, meet with a dietitian once and you get macros for the snapshot that you're existing in that moment. And that's why I encourage regular visits with a dietitian or nutritionist so that you can continue to update to where you're at. Because I've heard people online go, "Oh, I've just been staying eating my 1,600 calories a day and I'm in maintenance, but I'm still losing and I don't know why." And or there's other folks who were saying, I've stalled out, but I'm working out 5 days a week and I'm not moving anymore. And I'm like, you need to talk to the dietitian because it might not, it might be beyond what you're doing actually. Like we know that types of exercise will either cause, not necessarily a plateau, but muscle gain. And, that might cause the scale not to actually move, but your composition might be changing, or you might not be eating enough. And your body is starting to go into like a starvation hibernation type of mode, and it's trying to hold on to everything because that's what it's built to do. So I always I tell people you just got to check in with your dietitian, even if it's twice a year. Like, if you're once you're in an active maintenance, if you're not changing things on a regular basis, then maybe you can reduce it. But it was such a big thing for me, and my dietitian is checking in with me regularly through messages and, making sure that, as my activity increases, that I'm getting more nutrition. Like I'm supposed to be up to like 2,400 calories a day now and like 180 grams of protein because of how much I'm lifting. And that's a lot. Not everyone is going to be on that when they're in the losing phase or maintenance phase. It's all dependent on you, and that's why like personalized care is so important. And I preach about that as well.
Mhm.
Um, and then my mental health, my therapist has been a huge part of this journey as well. And you know it's been helpful to me because I accidentally found a therapist who I didn't know that they had any connection to the life that I have lived, but through my time with them, they opened up about having gastric bypass, struggling with reoccurrence, and then starting a GLP-1 because of listening to my journey, and then getting back to where they're in maintenance again. And they've gone through skin removal, and I'm getting ready to go through skin removal. So I accidentally found the right therapist for the right moment in time in my life and journey, but that's been so critical for me because it's been someone that has helped me work through um, all aspects of the journey, whether I was losing, whether I was not, whether I was in maintenance. It's just been very, very helpful. So, that is my kind of care team. I'm actually expanding it again. I'm adding a board certified obesity medicine specialist to my care team. Um, and, I still have a liver specialist. I still have, a few other doctors that I go and see here or there, but I make sure that my total health package is good, and I make sure that my doctors all can communicate with each other, or if one sends me one thing, I send it to the other. And um, I'm probably a more of a go-getter patient based on, just my life experience, but like other people can do this and you can have a fantastic care team around you. And it shouldn't be very daunting. And I think doing that and knowing that stuff has um, made me very successful on this journey. And I'm truly fortunate to have beat the average weight loss that is expected with these medications. I try to remind people that I fell outside of the norm, and please don't use me as like your benchmark or comparison. um, Pointing them back to like what the actual averages are from the data of the meds, and um, you know encouraging people to change their mindset about it. Like, and if you're losing, you're losing. That's great. But um, my focus has now been on composition and maintenance strongly. So I only weigh myself now like once every 4 to 5 weeks. And I'll tell you, the last 3 times I got on the scale, the number was up. The number was up. And I'm probably up about 15 from my lowest on this journey. And I've not panicked. Um, I'm not panicked yet, I should say. uh, I don't feel like any of it is like r- weight gain from fat. I've in an aggressive resistance training kind of workout routine 5 days a week. And but that is why I'm frequently getting body composition scans now. So I'm getting another DEXA scan later this month, which would have been about 6 months from my last DEXA. So I'm looking forward to compare. That will be my third DEXA scan over the course of this journey. And about a year since my first one. I had my first one last March. So it would be exciting to compare that data for me. But I won't take any action on that data just yet because I'm also next month in April getting another Sika scan. And I like to compare my Sika and my DEXA scans and then correlate the information and find commonalities between the two and then inform my decisions off of all of that data. Um, so, I'm doing things a little bit next level because I'm a data nerd. But if you have, the option of a Sika scan or a DEXA scan or an in-body scan, something that's not your home scale composition, because I'm going to tell you a lot of those home scales will mess with your mind because they'll either say you're very high in your composition or low, and they're not the same as one of those clinical grade that are verified against something. So, if you can check in on your composition, and especially DEXA scans are already recommended for checking for osteoporosis in people who are susceptible with it. So if you can even get it covered by your insurance, kudos to you. But they are becoming a much more affordable cash option for body composition now too. I'm fortunate that mine's under $100 whenever I want to go, which is fantastic because even a year ago when I started looking, they were over $100 to pay for cash. And if you live near an area that has a lot of like uh, research colleges or medical schools, I've found out that a lot of those programs actually usually offer DEXA scans at lower prices as well for patients because they want the data, like they want data too for whatever they're studying and stuff. So sometimes if you happen to be in one of those college towns, you might be able to find something that's more affordable for you too.
I never
Those are
thought
just
about
all things to throw out there.
Never thought about that. That's really a great thought. Yeah, and I know in my area, I got a DEXA scan before, and it was $99, I believe. And it's something that you don't need to get very often. So I think can be reasonable to incorporate. And I'm a big fan of checking your body composition because, as you mentioned, just following the number on the scale is not very helpful because ideally we're losing body fat and gaining muscle mass, and that'll look like, or it could look like, a neutral weight on that scale, but really you could be significantly improving your health both metabolically and functionally. So getting those body composition scans can be so powerful. It can be a little bit overwhelming or confusing, especially if you're early in this journey. And that brings us back to the importance of having a team around you. So sometimes primary care doctors would be able to help you interpret this. An obesity medicine physician should be able to. Many dietitians could be comfortable with this. Even fitness trainers, some of them really focus on it. So having those team members are so helpful to just interpret it and help you to take action on what those results are over time. So again, tied in that team that you build around you. And I think starting with a really great primary care doctor and or obesity medicine doctor is a great place to start to build your team. And like you mentioned, if you're not getting the support from that person that you deserve or that you're looking for, it's okay to see somebody else and see a new doctor, and then adding on the dietitian and therapist, counselor, then plus or minus a personal trainer, or even a physical therapist if exercise is really new to you or you're having joint pain. Starting with physical therapy can be a really great place to start. So thank you for going over that.
Yeah, of course. And I know we're coming up on our time. Um, but I'm very big on education and resources. I've started publishing some just personal blogs on procarenow.com under our blog section. Some of them are about advocacy. Advocacy is very important to me in this space, and one of my recent ones is about why patient voices actually matter in ending weight bias in healthcare. So if you're looking for, a quick read like that, that is, one I would recommend. If you're looking for something more from me, why community and mental health support matter. I even have one about things you should talk to your doctor about with if you're even remotely considering starting an OMM therapy, obesity management medication. Um, so I'm about putting resources out there for people, because we need that. We need content that isn't clickbait and just headlines. We need real tangible, um evidence based um material out there. So
Yeah. Well, thank you for doing that. And I will definitely include the link with this podcast or on YouTube, however you're watching or listening. And I'll also include your social media handles so people can follow you and, follow your journey and learn more from you. But yeah, thank you so much for being here, Zach. I really appreciate you taking your time and sharing your story.
absolutely, thank you for having me. Looking forward to working with you in the field in the future and seeing you out and about at conferences.